Dr. Linda Mckenzie is a native Detroiter who attended Cass Technical High School. She received her Bachelor of Science in Chemistry from Wayne State University and her medical degree from University of Michigan Medical School. She trained at Henry Ford Hospital, where she was the chief medical resident. She has worked as an internal medicine faculty member, training new doctors in both the inpatient and outpatient settings, and worked in the private practice. She is also an active fellow of the American College of Physicians and has served on an advisory panel for the Doctors of Tomorrow program, an outreach program at Cass Tech, which exposes underrepresented minority students to careers in medicine. She currently serves as a medical director at a major health insurance company. Dr. Mckenzie, thank you.
Hi, can everyone hear me?
Yes.
Excellent. All right. So first, I want to just thank you for allowing me the opportunity to speak about why vaccination is so important. First thing I'm going to talk about is the development of vaccines and how these current vaccines that have been approved, how they were developed so quickly. Then I'll talk about the vaccines themselves and some the dosing and side effects. And then I'll get back to why vaccination is important. So vaccines have been around for more than 200 years. The first one being the smallpox vaccine. And during the 20th century, and even up to the present day to some extent, most vaccines have been based on weakening a infectious entity by chemical inactivation or maybe serial cell culture. And these are all timely, they take a lot of time to develop. But even with these more time-consuming types of vaccines, we have been able to successfully eliminate diseases like polio, which have been devastating to us as a community and to the world at large. So let's fast forward to the 21st century. So our knowledge about how the immune system works has just increased quite a bit. And in conjunction with that, our knowledge about how the genetic structure of every living thing, including humans and viruses, is better understood and well known. And as a matter of fact, we've seen an explosion in drugs that actually, based on our understanding of the immune system and based on the understanding of the genetic code of humans and our ability to elucidate the genetic code of infectious agents, there's just been an explosion of treatment for some diseases that we've never even been able to treat before. So knowledge has changed. We're better. Like lots of science and technology in our modern world, we know more than we used to know. So this virus, the structure of it was actually known before even a single American got sick. And part of the reason for that is there were actually two viruses in the past. One in early 2000 caused SARS-1, and then one in 2012-13 called MERS, which was very similar to this current virus that has caused so much death and the consequent economic fallout and so forth, just pain for our community and the world at large. And furthermore, there were people who were working on the technology that brought us these vaccines. They recognized that this was going to be a problem, and they were working on it, again, before any American ever got sick. I like to think of this technology very much like computers. The early computers took up space in a large room. They were slow. Today's computers fit in the size of our hand, and they perform more than one function. So that is the evolution of the technology behind these vaccines. So what is unique about these particular vaccines? Well, as a matter of fact, I told you about the technology of the 20th century, mostly weakening a virus or chemically inactivating a virus. And so the ideal vaccine would be one that doesn't take a lot of time to produce, and is as safe as we can get it. And every step in this process is focused first on safety, and finally, does it work? So these vaccines are based on what we call messenger RNA, nucleic acid technology. DNA is what we are all made of, our genetic code, the structure of who we are. And it actually is not any kind of infectious agent at all. Messenger RNA, just as the name implies, is a set of instructions so that when you are vaccinated with this vaccine, what it does is it tells a certain kind of cell in your system to produce enough of a portion of that spike that you see on the virus. It's called a spike protein, so that your body recognizes it, produces antibodies to it, and it launches a whole cascade of infection fighting cells that are at the ready, so that when you're actually exposed to the real thing, it protects you and keeps you from getting sick. So that's the difference between this particular technology. Now, so there was a foundation of knowledge that allowed people to start working very fast. In addition to that, this is a worldwide pandemic. One of the things that delays the science and the evaluation of whether a treatment is safe or effective is recruiting patients. We had no problem doing that this time. So it was all of these kinds of things that allowed us to bring these two valuable vaccines forward. All right, so switching now to the vaccines themselves. As I said, safety is emphasized at every step in the process. So both of these vaccines are pretty similar. They're based on the same technology. And what happens is that you require 2 doses. Maybe there's somebody in the audience that has already had a dose. So depending on which vaccine you get, you get 1 dose and then you get a second dose either 3 to 4 weeks later. The side effects from these particular vaccines are very similar to flu side effects or flu vaccine side effects. So you might get a little bit of muscle soreness, you might feel a little achy, maybe a headache, and for some people even maybe a low-grade fever. But those side effects tend to occur only after the second dose. And interestingly enough, usually in younger people. And why is that? Because they tend to have more of a robust immune system. So, and the side effects don't tend to last more than 2 or 3 days. So these vaccines are remarkably effective, 95 and 94, 95% effective. That is an incredible amount of level of efficacy. And in terms of uncommon side effects, you may have heard in the media that there were some people that developed a severe allergic reaction. This is pretty uncommon. And what happens is that when you get when you get your shots, you're going to be monitored because we know how to treat allergic reactions. So this should not deter you from going ahead and getting the vaccine. So now I want to switch to why this is so important. Now, I really hope that I'm preaching to the choir on this. You know, we are celebrating Martin Luther King Day today. We are celebrating love. We are celebrating unity. I want to pause and give you a little bit of context on why this is important in case someone doesn't feel that they have enough already with what we've seen happen to people around us. The death rate as of today is almost 400,000 Americans. To put that into context for you, there were 450,000 Americans who died as a result of World War II. We are at war with an enemy that we cannot see. And the outcomes for minority communities like African Americans are worse. We know that. And we've been clamoring for ways to address those kinds of inequities. And there's more than one reason for that. Representative Carter talked about what we in the medical field call social determinants, like air quality and water quality. But we have this amazingly potent tool now that has come to us at the right time, just when we need it. And so in thinking about this, we want to think about the lesson of Martin Luther King. We have an amazing opportunity for healing, both literally and figuratively, spiritually, and unity. We have the opportunity to not just help ourselves, but help our fellow man, our fellow community member, even those who may be more misinformed than us. So I want to just challenge all of you that if you do have any kind of misgivings about these vaccines, I can tell you that they're safe. The process by which they were brought to us was incredibly transparent. And it has come to us at a time when we really need it. Some of you may have some specific medical conditions that you may want to talk to your own physicians about, but this is something that we can do not just for ourselves, but for our community. So I'm recommending vaccine, and if there are any questions that I can potentially answer for you, I am happy to do that.
Right. Hi, Dr. Mckenzie. I'm Danielle, a member of the AMUS support staff, and I'm going to read some questions from our chat for Q&A.
Okay.
Our first question is from Mary O'Connor. If you are vaccinated, can you still carry and make someone else sick?
Well, there are some unknowns about this. And so one of the things that is still being monitored is whether after vaccination, an asymptomatic carrier can transmit it to someone else. We don't yet know the answer to that. The science is changing in real time. And so we are looking for the specific answer to that question.
All right, thank you. Our next question comes from an AMUS staff member. Do we know yet how long immunity will last from the vaccine? Will we need a booster?
So what I'm going to say, again, the science changes. So what I say today may be better known and will be better known a little bit later. So the studies were designed to monitor this for a couple of months, but there's actually some preliminary data out there that it lasts much longer than that. We don't know precisely how long it lasts. The best guesstimate is that this particular vaccine may require a booster.
All right, thank you. So we have one other question in our chat, so I'm going to encourage anyone with additional questions to please put it up there. This next question comes from Keenan Sinan. What are the chances the vaccine becomes ineffective due to mutations of the virus?
So recently we have heard about some mutations. And again, this is being studied. Some of them are more transmissible, but we don't have any evidence to date that they are more deadly than the one we're dealing with now. And again, there's some preliminary data that suggests that these vaccines are protective. And I might add, the beauty of this technology is that it's fairly easily modifiable. So it's an incredible display of a need and an ability to get something that will help all of us.
All right, thank you. For this
There's
next
one last question in the chat box that asked if someone has had COVID-19 and recovered, how long do they have immunity, and should they get vaccine so others can get it?
So one of the unknowns again is how long the immunity lasts, not just with the vaccines, but in other people. And so the recommendation from the CDC right now is to get the vaccine, even if you've had it. even if you've had the COVID-19 viral infection.
All right, thank you. One moment. All right, regarding the age of a person, you noted younger have more robust systems. What about the older person? Norway reported about 23 deaths of 80-year-old patients, I think, after the first shot. Yep.
Yeah, so the vaccine covers people that, depending on which one it is, 16 or 18 and up. And it was, designed to be effective in all adult ages, including older people, because we know that older folks, particularly older folks with comorbidities, have the highest risk of death.
All right, this next question. What are the primary reasons for persons not wanting to get vaccinated, and what is being done to address these reasons and concerns? And what can we do to support people getting vaccinated?
Well, that's a question I would pose to any of you. Who out there is reluctant? Tell us all why you don't want to get this vaccine. A lot of times it's rooted in misinformation about it, and sometimes just fear. People don't want to do things that they regard as experimental to their body. So I'm not going to speculate too much on that, because the science is very sound here. Again, vaccines have been around for a long time and they're just getting better. But I think that we all can be an example. So, get our vaccine, let our friends know that we've gotten a vaccine. And as a, physician, I want to be sure that I answer any question, and no question is, and I want to make people comfortable that whatever question they have or concern, I want to hear it, and just address it in the best way that I can.
Thank you. We have another. If less than 1% of individuals that contract COVID-19 dies, what percentage of those individuals were people who did not exercise the precautions already in place, such as mask wearing and social distancing?
I'm sorry, repeat that question again.
About what percentage of individuals who contract COVID-19 did not exercise precautions already in place, such as masks and social distancing?
Yeah, well, so there's some history behind the success of isolating yourself, right? There was during the Spanish flu that occurred in the early 1900s, there was a school for the blind that had no contact with anybody, and not a single person got sick. So, as a physician, here's what I would tell my patients in the office. I would tell them most diseases can be completely prevented by behaviors and what we take in from a nutritional standpoint. That's very apropos here. Prevention is hugely powerful. And actually, Michigan is doing a little better than a lot of states out there on that. So then when you add this powerful tool, this vaccine, we can do this. We can kill this virus. We just have to be on board for both of those things. Unfortunately, sometimes that's hard to do. We're seeing that played out on a national scale here, and not just here, but across the world.
All right, thank you. We have another want to know how many vaccines do we need to get, and how is it similar to the flu shot?
Well, so 2 shots. The first shot, and then 20, depending on which vaccine, either 3 or 4 weeks later. And it's similar in the sense that, the potential side effects, the most common side effects, are very much the same. And they're both upper respiratory illnesses predominantly.
All right, thank you. We do have time for a couple more questions. If anyone does have any, you may put them in the chat. Wait just one moment.
Danielle, thank you for handling those questions and passing them on to Dr. Mckenzie. What I'm going to ask is that if we receive any more questions, we will do follow-up emails with sharing the materials with everyone. And if we have questions, we'll get answers as we can from Dr. Mckenzie and include them with that follow-up communication.